Sek Yow, are you ready to start?
Sure.
We still have very last participants. Let's give it a couple of minutes before we start, just so that everyone has came in and set to the call. Okay, good morning, all. We will start approximately in 2 minutes. Just waiting for a few more people to get in before we start. Just a bit of housekeeping here. If you have any questions, we have the question and answer box. You can drop your questions there, and we will get to your questions at the end of the webinar today. Okay, we are going to start. So, a very good morning for everyone who's joining us today. We will be speaking to Soo Sek Yow. She's actually a nutritionist with expertise with health campaigns focused on evidence-based nutrition and debunking food myths. As head of nutrition unit at ACE Canning Corporation, she promotes the health benefits of soya to healthcare professionals in Malaysia and Southeast Asia. She also advises R&D and marketing teams to ensure product accuracy and alignment with the latest research. Good morning and welcome, Sek Yow. How are you doing this
Good
morning?
morning. Good morning. Good. Thank you for having HOMESOY and us here today. It's really awesome to be here as we come together to fight against cancer and to make a difference in the fight against cancer.
So, are you excited? I'm sure everyone is excited to see you here today. So, hi everyone. So, without further ado, I know we have started at least 5 minutes late, so I'll try to wrap up the session as soon as possible so that you can get back to your work. So, I just want to understand why is supporting Cancer Research Malaysia important for HOMESOY's corporate social responsibility?
At HOMESOY, actually our company is Canning Corporation. We have over 40 years of experience in the soya beverage industry. we are very committed to delivering high quality, nutritious products. We prioritize about taste, nutrition, and also functional properties. So at HOMESOY, the brand of our soya milk, it's all about promoting good health, good nutrition, and wellness. So it is really important to us, that our health and nutrition communications are always backed by scientific evidence. So, and we know that one of the major health concerns in Malaysia that everybody dread about is cancer. So, cancer touches all of us.
Mm.
It is a devastating disease that impacts individuals, families, and even the communities. So therefore, we believe, that contributing to the fight against cancer is really important. So in particular, particularly in breast cancer, which is the most common type of cancer in Malaysia as well as in the world. This is really affecting women. Okay, and so we believe that supporting with Cancer Research Malaysia, it aligns perfectly with this goal. So we know that you're doing amazing work in cancer research
Thank
and
you.
even patient support. And we are really proud to be, part of this mission of yours. Doing all this is not just about fulfilling our CSR goal, but we are really, committed in awareness on breast cancer, awareness on cancer. So we believe raising awareness about early detection, about supporting advancements, especially advancements in cancer research. It is really important towards a future where, we can beat cancer, we can outsmart cancer. So we hopefully, one day we can achieve that. And we are very proud to be sharing this common objective with Cancer Research Malaysia in supporting the breast cancer initiatives. And we are confident that working together, we can come up and make a meaningful difference.
Thank you, thank you.
Yeah.
It's with the support and trust from donors like you all that we have managed to come this far. Come up with groundbreaking research. As Sek Yao, not only in breast cancer, we are also doing research in oral cancer, and hopefully
Yes.
we hope. We have developed the oral cancer vaccine, which we hope to test it in the first in human clinical trials very soon. And this would not be possible without the support and help and trust by the donors like y'all. So thank you, thank you, thank you. We also hope to create a future free from the fear of cancer. We will never say that we'll eliminate cancer, but what
Mm.
we want to give people is that we want to create a future free from the fear of cancer.
Yes.
So
Yes.
my next question to you, how does HomeSoy integrate its product offerings to support Cancer Research Malaysia's mission and research goals?
I know, we are a few years into our collaborations with Cancer Research Malaysia. So some of the activities that we have been doing together would be like activities in raising awareness on breast cancer. And, we have newspaper articles together with you all. We have radio talks, we have health talks, and we also have a fundraising effort. So right now we are in our second year with our annual donation of 50,000 ringgit to Research Malaysia. And this is renowned to support research on Asian cancers. So these funds, it is partially raised from the sales, from each and every pack of HOMESOY 3.0 soya milk that we are selling in Malaysia.
Oh, that's very nice. I remember whenever I go to the grocery store and I see that soya milk with that pink label, it always reminds me of how community and different stakeholders come together to support one another in this fight
Mm,
against cancer. Because what many people think is that the fight against cancer is only in the hand of people who are going through the disease. But
mm-mm.
honestly, everyone needs to come
Yes,
together
it's
to work with.
yes,
Yeah,
all of us.
yeah.
Mm.
So can you explain me why do you think it's important for companies and Malaysians to support Cancer Research Malaysia?
Yes, it's definitely important. I think supporting organizations like Cancer Research Malaysia, it's important because there are several reasons. Firstly, cancer research conducted specifically for Asian populations, including Malaysian, is really important. We know that many existing research that we have nowadays may not truly reflect our unique genetic or even environmental factors that influence our cancer care in our region, in Asia, in Malaysia. So what we have out there are a lot of research being done that are not about our local or Malaysia or Asian scenario. So organizations like Cancer Research Malaysia, where you conduct research on Asian population, I think all these data play a very important role, towards the cancer care in the future. For example, not only that, for example, we know that again, breast cancer incidence is, very high in Malaysia. But although it's high, but we are not the highest in Asia in terms of number of cases. But however, we know that our survival rate is one of the poorest in Asia. And that is really sad because, it's not like we are short of any access to diagnosis or access to treatment. It's available in Malaysia, whether you go to a private or go to government hospital. But the sad thing is we see a lot of late diagnosis and also delay in treatment. So we need to know why, cause all this and also how to improve. I believe that our research from you all will help to answer some of these questions to really, have a better access to, or maybe have more motivation for people to come and do early detection, to do screenings, and also to make treatments more accessible, more available, less scary, to our people. Yeah, I think, this is where cancer research will play a very vital role. And also, Cancer Research Malaysia, although the name research, right? I know that your organization is just is more than just a research institution.
Yes.
You're dedicated to advocate and support patient care. So by supporting Cancer Research Malaysia, I believe companies and individuals can really contribute, to all this groundbreaking research, patient support programs, and ultimately, to a healthier future for all Malaysians. So yeah, so I think that is why it is important that we
Yeah.
support CRM.
Yeah, so you brought up a very important topic, very important point in genetics about why we are doing this in Malaysia, about why we are doing it in Asian cancers. See, over the years, science has showed us that our genetics are different, and
Mm-hmm.
what happens when research is done overseas, right? It's not that Asians are not included, but Asians are minorities. So
Yeah, but the
that's why
environment is different. Yeah,
environment is different, our lifestyle is different. So that's
food
why,
is
like,
different.
correct.
Mm-hmm.
So we are not really included in research. We are now when, especially when there's more Asian representation.
Yep.
But then it's nothing like doing it here because, like I said, our lifestyle, our food, everything is different, right? So
Mm-hmm.
thanks to Cancer Research Malaysia, we have improved Asian representation in cancer research from 2 to 20%, which is a huge number, even if it's just 20%.
Yes.
Because from this 20%, you get a lot of data that can
Yep.
help cancer patients in Asia. What we also
Exactly.
found is that some of the genetics of Asian breast cancer patients are different. Therefore, treatment may
Mm-hmm.
also work differently for them. So
Mm-hmm.
identifying this is very, very important because, when cancer patients come to us, you do not, they may be in the fight with maybe the stage 4, stage 3. So it's
Yep.
very crucial whatever treatment that is given works effectively for them. So understanding their
Mm-hmm.
genetics, getting this data is very, very crucial for doctors too. So
Mm-hmm.
that is why, Cancer Research Malaysia is here. We want to make sure that we do the research to help these people,
Yep.
like you said, even early detection tools. Hopefully
Mm-hmm.
someday we have early detection tools that will be, now we have genetic counseling. If you have the
Mm-hmm.
BRCA gene, you may be at risk, at this disease, like a mutation in the BRCA gene. So I think it's very important. It's thanks to research that we found the BRCA gene, right? So just like that,
Mm-hmm.
we hope that with other kind of cancers as well, we can come up with better detection tools so that we can create a future free from the fear of cancer. So,
Mm-hmm.
yeah, you also mentioned that you are aware that we have patient support teams and
Yep.
patient support community outreach
Mm-hmm.
groups and all that. And HomeSoy has been very supportive with our community outreach programs. So thank you. And maybe you could explain how do you support this?
Yes. In addition to what I mentioned earlier on the fundraising effort, the 50,000 ringgit donations, we also join you in your community outreach programs, such as when you have your fundraising efforts, we will try to donate regularly with our products. So we understand some of these fundraising efforts, not only to generate funds for your research, but it is also important to raise awareness on about cancer prevention and early detection. So, and one program that we are particularly very proud to be involved is your patient navigation program.
Yes, yes, yes.
Maybe you can also elaborate more on this, on the patient
Sure, sure,
navigation program.
definitely. So, our patient navigation program at Cancer Research Malaysia specifically supports low-income women with breast cancer by
Mm,
guiding them through their treatment journey. The program helps them access timely care, manage challenges, and navigate financial and emotional barriers. Patient navigators aim to improve treatment adherence and enhance the overall quality of life of for these women. So basically, we are planning to expand to more public hospitals in Malaysia
yep.
because we have seen the impact of the program. What we
Yes.
notice is women know that they have breast cancer, but coming and seeking treatment, it's a duration, right? It's not like a one-time
Yeah.
thing for cancer.
It is not an easy journey as well.
Correct,
Yes.
correct. So you need to give them the emotional support, the moral support. Sometimes the patient navigators also visit them in their homes just to let them know that they are not alone in this journey.
Yeah.
And
So yeah, I think it's really amazing because at one time I was talking with some of your colleagues working at the centers, and I heard that they actually go to the patient's family to the home to cook for them so that they have time to go to the hospital for treatment.
yes, yes,
I
yes, yes,
think that is really amazing. That really touches our hearts when I
correct.
tell this to all my colleagues at HOMESOY. And also I remember she was saying that sometimes they do not have transport, for
Yes,
example,
yes,
to go
yes.
to the hospitals for treatments. And patient navigation center program, you actually help with them with the transports for them. Yeah, I think that's really amazing because when someone is diagnosed with cancer, it's first of all they're hit with the very big news. They become kalam kabut,
Yes, yes.
and with the center, I think it's the program is really help to navigate them, and I believe this is where you um explain to them how they can approach, with the treatment journey, how they could deal with their life. And I believe it also comes with a lot of support and help towards their mental as
Correct,
well.
correct.
Yeah.
Yeah, yeah.
Mm.
So, we also help them, guiding them where they can go and get financial
Mm.
support and,
Ah,
calling them up, reminding them, to come for their treatment. This is very, very important because especially
yes.
in a low income community, um, you know,
Mm.
when they need to miss their job for the day, they have to apply for leave. Some of them are daily wages. If they don't go to work,
Yeah.
that means they don't
They don't
get
get
money
paid. Yeah.
they don't get paid. So
Mm.
it's a very different lifestyle for them.
Yeah, it is very sad when the help did couldn't come, at the first place for them. Yeah. So
Correct,
I
correct.
think that's why it's great at the PNP, at the patient navigation program. Your colleagues are doing amazing work there.
Thank you,
They're
thank you.
really giving great support. Like you mentioned, when people is diagnosed with cancer, they really need a lot of support.
Yes,
Uh, a lot, like it's just like words of encouragement, and also reminders, and that helps a lot. Yeah.
yes, yes. Thank you, thank you. So, I just want to ask you, how do you think Cancer Research Malaysia stands out as compared to other NGOs that you
Oh, definitely it's different. I
know?
believe that the Cancer Research Malaysia is quite unique because you have like a holistic approach. So not only you have the world-class researchers and scientists, we talk about, you're also committed to patient care, to community outreach. So this is a very comprehensive approach that I believe that make a real differences in our lives, in people's lives, and especially with people with cancer. So, and also with Cancer Research Malaysia, you have numerous breakthroughs in cancer care. I think you already mentioned just now that you have like the ARICA, the
Yes,
Asian Genetic Risk Calculator.
risk calculator.
It's
Yes,
like a breast cancer risk calculator for designed specifically for Asian women. You have the very first Malaysian-made oral cancer vaccine, which is, I think, undergoing the last phase of the clinical trial,
No,
if I'm
we are yet to go into human clinical trials, but
yeah,
our
yeah,
animal studies have already shown very significant
yes.
results. Yes, yes, yes.
Yes, and I understand that Cancer Research Malaysia has just launched the mobile app to screen for oral cancer. I think that is really amazing because it make screening really accessible,
Correct.
and how you all what do you call that? You put it out, to kampong kampong, and then you speak
Yes,
to the tok penghulu and teach
yes.
them, to get people to come forward and do screenings. Because at first when I heard about this, I was wondering why oral cancer?
Mm,
Because in the urban area, we don't hear very much
correct,
about oral
correct,
cancer.
correct.
But what I understand from Cancer Research Malaysia team is that actually oral cancer affects a very big part of Malaysians, especially in East Malaysia,
Yes, the Bidayo
Sabah
community at high
Sarawak.
risk. Yes.
Yes, and yeah, but these communities, they may not have enough access to dental clinics or the hospitals to do screenings, right? So I believe that this app, is going to change lives. Yeah.
Thank you, thank you. You have certainly done a lot of reading about us, which means that you're really passionate about where we are,
Yes.
our vision,
Yes.
our mission. So thanks a
Yes.
lot.
I
It
always speak
means
to your team, we are
yes,
always
yes.
talking
Uh,
about what is going on, and
Yes,
yeah.
yes. It's very nice to hear from a donor about on how you feel and how you trust us. It's very
Mhm.
important to us. So last but not least, Yao, you have spoken about you've spoken about how far Cancer Research Malaysia has came in helping Asians and Malaysians, whether it's the Mimosa app for the early detection of oral cancer, whether it's coming up with the first oral cancer vaccine that we are waiting to go into human clinical trials, or Erica, the genetic risk calculator for Asian women, developed for Asian women. So, with all this in mind, what is your message to Malaysians out there who are listening to this webinar here today?
Yes, I would like to encourage everyone who's listening to us today and, in the future as well, to support Cancer Research Malaysia in any way that you can, whether it's through donations, to volunteering, or simply spreading a word of awareness about Cancer Research Malaysia, and also awareness about cancer care. Be aware and do, your due diligence, do your own screening. If you have any questions, speak to healthcare professionals. And yep, together, I hope that, supporting Cancer Research Malaysia can really make a difference.
Thank you, Sek Yao. So if you would like to know how you can support us, I'm going to show you some of the fundraising events for
Mhm.
2025 and how you can support us. Right. Okay, so these are our fundraising events for 2025. We have treasures coming up on the 18th and 19th of January, and we are starting with a donation of 100 ringgit onwards. If you're into musical performance, you like dancing, this would be a great one for your family, and you kids can also come. We have Life is Funny 2.0. It's a comedy night. If you want to laugh your life away, if you're feeling stressed, you will like some good laughter. You can come for a comedy night. It's on the 23rd of February, and donation starts from 100 ringgit, about 100 ringgit and above. And we have other upcoming fundraising events. We have a lab coat run happening somewhere in April, May. We have the Cancer Research Malaysia's anniversary happening around May. And we have our annual Terry Fox Run KL. Location is to be announced, but it will be around September. So stay tuned and sign up to our newsletter if you would like to know more about our events. So these are some of the current events that are coming up. For the comedy night, we have Joanne Kam Popo, we have Bai Zura, we have Douglas Lim, we have Dato Leonard Tan, and we also introducing our 2025
Mm.
calendar. So, if you would like to get our calendar, there is a donation for it. You can scan the QR code here and get more details. We also have certain packages, so please, please, please support us. We also have like a direct donation program, like a recurring donation program, where you can actually commit to us with a minimum of 10 ringgit per month. You can sign up with us. So just so that everyone is aware, we do give tax exemption receipt for any donations of 50 ringgit and above. Okay. And last but not least, if you can also help and support us by spreading awareness, spreading the news, spreading the name of Cancer Research Malaysia. You can share our IG page, you can share our Facebook page, you can sign up to our newsletter, you can become a volunteer for any of our upcoming fundraising events. And I would like to hear from you how our webinar went this morning. Please, please, please submit your feedback form. Just take a QR code, scan of the QR code here, and send me your feedback. I would like to hear from you. So we have officially came to the end of our presentation today. I'm going to open up the floor for a Q&A. So how can someone ask, how can I get the e-cert? So the e-cert will be emailed to you within a month of the webinar, after the webinar has concluded. Let me see if there's any question. Anyone has any questions? If you have any questions,
There's a question.
yes. Is home soy product sugar-free and is it suitable for breast cancer patients or survivors?
Yeah, I can answer that. Yes, at HOMESOY, we actually have a very wide range of soya milk products. So from a less sweetened to brown sugar to flavored and to no sugar added. So we do have two variants on HOMESOY soya milk that is without sugar, without any added sugar in, not just normal sugar, not even sweeteners. We don't add in sweeteners. So there are two variants of that. One is with the regular level of protein, and another one that I mentioned during our during our talk just now is the HOMESOY 3.0. That is without added sugar, and it has also more protein, and we also fortify it with calcium and vitamin D. So, and the question is about whether it's suitable for breast cancer patients and survivors. Yes, soy milk is definitely safe for breast cancer patients, for even survivors who have, undergone treatment and all that. So yes, it is safe. We have our products being given to women or to patients in hospitals through even when we do breast cancer screening during October month, we actually give out the products for free. And what we mentioned earlier at the patient navigation program, we also give away this product to the patients for free to the B40 community. So yes, breast home soy or soya milk is actually suitable for patients with breast cancer because there are many research actually talk about this that showing no harm, but sometimes you actually see a reduction in the risk. So if you have any further questions, you can direct it to us again. I can elaborate further.
Okay. Answer the question. Do doctors usually ask patients to drink milk? Why? So this would be a best questions to ask the doctor themselves because I'm not a doctor,
Yes,
Sek Yow is not a doctor. So
yes.
this would be best you ask your doctor on why they will ask you to drink milk or soy milk. I think
Mm.
the person mentioned milk, so best you ask you speak to your doctor about it.
Yeah.
Uh, okay, I think we are done with the questions. There's no more questions.
Okay.
Okay.
All right.
Thanks a lot, Sek Yow. Thank you for your time. Thank you for trusting us. Thanks to HomeSoy, A-Scanning for your
Thank
donation, for
you.
your support, for your trust over the years. It's because of donors like you we are here today. So thank you. Thank you.
Okay. Thank you for having us.
Thank you. Take care. Bye-bye. Bye,
Okay.
everyone.
Bye-bye, everybody.